Hello everyone, welcome to AY Tutorials. Today we are going to see nasal decongestants. Nasal congestion, that is stuffy nose. Nasal congestion can be caused by anything that irritates or inflames the nasal tissues. Infections such as cold, flu, or sinusitis and allergies are frequent causes of nasal congestion and runny nose. So, in nasal congestion, there is difficulty in breathing, usually due to the swelling of the mucous membrane lining of the nose. And there are certain common causes of the nasal congestion, and they are not always related to an underlying condition, but it may be caused by allergies, dry air, foreign body in the nose, then some hormonal changes, stress, thyroid disorders, tobacco smoke, etc. Nasal decongestants. Nasal decongestants are the drugs that reduces the congestion of nasal passages, which in turn open the clogged nasal passages and enhances the drainages in the sinuses. So these decongestants are over the counter medications which helps to break this cycle of congestion and pressure. Decongestants work by causing blood vessel to constrict, which helps to relieve the congestion caused by the dilation of blood vessels in the nasal passages. These drugs they stimulate the alpha adrenergic receptors of the respiratory mucosa to help the vasoconstriction that leads to shrinkage of the swollen nasal mucous membrane and reduction of the tissues, hyperemia and edema and nasal congestion. Here is the common mechanism of action of nasal decongestants. Decongestants stimulate the alpha 1 adrenergic receptor, which releases the and enhancing noradrenaline and adrenaline activity. Then vasoconstriction and constricting of nasal vasculature takes place. Then decongestion of nasal mucosa and paranasal sinuses occurs, which results in the reduced inflammation or swelling and mucus formation in these areas. Classification of nasal decongestant drugs. First one is alpha 1 adrenergic receptor agonist. In that, ephedrine, levomethamphetamine, phenylpropanolamine, and pseudoephedrine. Then second one is the alpha 2 adrenergic receptor agonist. In that, nafazoline, oxymetazoline, and phenylephrine. Third one is the corticosteroids, and in that beclomethasone, dipropionate, and prednisolone comes. Mechanism of action of nasal decongestants. Here in first blood vessel, that is the normal blood vessel, so oxygen goes inside very easily. Second one is the dilated blood vessel, and so oxygen is not going in a proper way, and that's why nasal congestion occurs. In third blood vessel, there we have used alpha receptor agonist, and that's why that the contraction of that blood vessel takes place, and so oxygen goes inside very easily. Here I have mentioned how alpha 1 adrenergic receptor agonist works. Due to the nasal congestion, vasodilation of the nasal blood vessel occurs, which causes the narrowing of nasal pathway. But whenever we are using alpha 1 adrenergic receptor agonist, it causes the vasoconstriction of nasal blood vessel, and so it broadens the nasal pathway and decongestion occurs. First drug is levomethamphetamine. It is the sympathomimetic vasoconstrictor. Mechanism of action: it temporarily relieves nasal congestion by constricting blood vessels in the nasal mucosa. So it causes the constriction of the blood vessel, and so the nasal decongestion occurs. Adverse drug reaction: it causes hypertension, tachycardia, stomach cramps, dizziness, and headache also. Uses: it is used as a sympathomimetic vasoconstrictor and nasal decongestant inhaler. Here is the mechanism of action of alpha 2 adrenergic receptor agonist oxymetazoline. It binds to the adrenergic receptor, which activates alpha 2 adrenergic receptors, and it causes the constriction of the arterioles in the nose, and which leads to decrease in the nasal congestion. Uses of oxymetazoline. It is used in allergies, cold, and also used in sinus congestion. Corticosteroids. They are having anti-inflammatory effect which work to turn off the immune system cells in the inflammatory responses involved. Corticosteroids decreased inflammation which results in decreased congestion, and so the nasal stuffiness is relieved. Nowadays there are too many nasal decongestant sprays which are having corticosteroids, and they are available locally to reduce the nasal inflammation and mucus, which effectively relieving the symptoms of nasal allergies. Here we have finished with the topic of nasal decongestants. If you like this video, please like, share and subscribe to the AY tutorials. Thank you.